Hi, this is Dr. Philip Cordova with Core Chiropractic. We are dealing with a video that our friend Casey Tedrick posted about leg length difference. The comments have been solely focused on what the information was on her x-ray. I think we're missing the larger concept of the benefits of addressing leg length difference and making sure that your legs are even if you're going to hold your adjustments as long as possible and also avoid injury. So this comment said 3 millimeters, that's nothing. I agree. That is like the bare minimum thing that we probably would ever address. In fact, our threshold is we take that initial AP x-ray. If there's 5 millimeters of difference, then we go ahead and put that into their care plan to do a leg length x-ray. Because we want to find out how much of that is anatomical and how much of that is functional. Functional differences mean we can adjust that out. Anatomical difference means we could adjust them forever and they were never going to even out. So we want to make sure that we address that as much as possible. I do keep 3 millimeter lifts here in the office because we have seen enough difference on very active people that 3 millimeters in their shoe while they're running, especially working out, they've noticed such a difference. Now, if they're somebody who are not very active or they just sit all day, they're probably not going to do the heel lift. Somebody who cares about every little thing of how they're exactly going to work right so their body can function at its optimal level, probably going to want to do something about it because they will notice a difference, especially when they're running, especially when they're active. So while 3 millimeters is nothing for most patients, it can make a big difference on people who are particularly active and athletic.